Greetings from Indian Journal of Anaesthesia. I will be discussing an original article from June issue of Indian Journal of Anaesthesia, that is, Dexmedetomidine for reducing succinylcholine-induced myalgia in patients undergoing electroconvulsive therapy, a randomized controlled trial. Electroconvulsive therapy is an effective intervention for psychiatric patients. Succinylcholine is considered the drug of choice for muscle relaxation for electroconvulsive therapy. Significant adverse effects of succinylcholine-induced fasciculations and myalgia are known. An anesthetic agent that provides amnesia with minimal effects on hemodynamic stability and seizure duration is preferred. Dexmedetomidine inhibits central sympathetic outflow at presynaptic receptors, reducing peripheral norepinephrine release due to its selective alpha-2 adrenergic agonist action. The authors used a minimal dose of dexmedetomidine in electroconvulsive therapy, as the dose of succinylcholine used was also less, that is 1 mg per kg, but it can potentially cause fasciculations and myalgia. Therefore, the study aimed to determine the efficacy of low-dose dexmedetomidine in reducing succinylcholine-induced myalgia in patients receiving ECT. The study's primary objective was to compare the incidence of myalgia and fasciculations, and the secondary objective was to find any changes in hemodynamics, that is heart rate and mean blood pressures, in patients receiving and not receiving low-dose dexmedetomidine. The study was approved from the Institutional Ethics Committee and it was registered under CTRI. It was a two-arm, double-blind randomized controlled trial where participants belonging to 18 to 65 years of age with American Society of Anesthesiology ASA physical status 1 and 2 and undergoing ECT were recruited, whereas the patients who were blind or deaf or incapable of understanding the language, had second or third degree heart blocks or persistent bradycardia, were pregnant or nursing, were allergic to dexmedetomidine, or were on drugs such as beta blockers or other antiarrhythmic drugs were excluded from the study. The study had two groups, Group D and Group C. The Group D was the intervention group, where IV dexmedetomidine 0.25 micrograms per kg diluted in normal saline to make a volume of 10 ml was administered over 10 minutes, whereas the Group C was the control group, where 10 ml of IV normal saline 0.9% was given over 10 minutes. Sample size was calculated using CineCalc software. The sample size calculation was based on the results of a reference study by Celebi et al. The authors aimed to detect a myalgia score of less than 10% with dexmedetomidine, as it was found that the incidence of myalgia in the reference study was 33%. With a power of 80% and type 1 error of 5%, 49 subjects were required per group, inferring a total of 100 patients for the study, 50 in each group. Sample size statistical analysis was done using statistical package for social science statistics software, SPSS version 26. The demographic details of patients in both the groups were comparable. Regarding the outcomes, there was a table given demonstrating comparison of variables between the two groups. It was found that myalgia scores as well as fasciculations were significantly lower in Group D, that is the intervention group, as compared to the control. The p-values were correspondingly highly significant. Regarding the secondary outcomes, the authors demonstrated that mean arterial pressures and heart rates were comparable at all the time point intervals in both the groups. So in this study, administering 0.25 micrograms per kg IV dexmedetomidine effectively reduced succinylcholine-induced fasciculations and myalgia in patients receiving ECT. Dexmedetomidine is a centrally active alpha-adrenergic agonist, which causes inhibition of substance P release in the dorsal root neuron and is effective in fasciculation-induced pain, possibly due to stimulation of alpha-2 adrenoreceptors in the spinal cord. It is advantageous as it decreases the hemodynamic response during ECT without influencing the recovery time. The study holds importance as this low-dose dexmedetomidine has never been tested in ECP patients for succinylcholine-induced myalgia, and this minimum dose has shown its efficacy in controlling myalgia and fasciculations without any adverse effects. However, as a limitation, this is a single-centric study, and further studies may be needed to validate the findings. Therefore, as a conclusion, a low dose of dexmedetomidine 0.25 micrograms per kg effectively reduces myalgia and fasciculations due to succinylcholine, given in a dose of 1 milligrams per kg in patients undergoing electroconvulsive therapy. Thank you.